Hi, this is Michelle Walker. Today I'm going to be showing you how to do a soap suds enema on a patient that is experiencing constipation. And first is the co-wipe. You want to check your orders and make sure that you check your patient for allergies. You want to assess your patient and assemble necessary equipment needed for the procedure. Wash your hands prior to beginning. You want to identify yourself to the patient and identify your patient with two identifiers. You want to provide for client privacy, and you want to explain, educate, and evaluate your patient. So I've already, if you can see it, I've already primed my enema tubing, and we are using an IV bag, pretending it's a soap suds enema. You want to make sure that you check your orders for the appropriate amount of fluid that you're going to be using. Today we're going to be using 500 mLs of water, and you're going to mix in your soap suds packet with that. You want to test that temperature on your arm. You want it between 105 to 110. You want to explain this procedure. It can be a little uncomfortable and a lot of pressure down there for the patient, so just make sure you let them know what to expect. Goal is for them to hold it retain the fluid for 5 to 10 minutes to let it soften up the stool. But you want them in a side lane position. So I have my patient gowned and draped for privacy, and you want them on their left side, and take the top right leg and kind of bend it in a little bit for good alignment. I'm going to go ahead and put my gloves on here. So you want to go ahead and make sure that your solution fills your tubing. Okay. You want to lubricate your the end of the rectal tube with a good amount of lubrication so it goes in easily. You want to check the anus for any hemorrhoids or bleeding, any complications before you insert it, because you definitely don't want to insert that. If they have that, it'll make it painful. All right, so I'm gonna hold this up here for right now. All right, so you're just gonna warn the patient that you're gonna go ahead and insert about 3 to 4 inches. You're gonna insert it with your clamp. You want to hold the bag about 12 to 18 inches above the anus, and we'll pretend that that's in place there. And then you're going to slowly release your clamp as you're releasing the fluid into the anus, and you want to slowly release all the fluid. If the patient is having any pain or asks you to stop, just stop for 30 seconds, give it a rest, and then restart it after 30 seconds. And then you want to, once all the fluid is emptied into the patient, or the patient can no longer tolerate the procedure, go ahead and remove everything, all the tubing, and dispose of it. You want to assist your patient. You want to assist your patient to the bedside commode or a toilet, and you want to make sure that you instruct them not to flush until you inspect the bowel movement that they have passed. After they do pass, you want to go ahead and provide them hygiene, and then also assist them back to the bed, and then comfort and safety. And then you want to go ahead and wash your hands. Set him upright. You want to go ahead and remove your gloves, wash your hands, and document your findings. You want to document the time and amount of fluid that you did, what type of enema you did, of course, how the patient tolerated it. You want to notate the amount, consistency, and color of the stool. And then you also want to document if the patient had any relief from the procedure. And that is everything. Thank you.